Great.
Hello, everybody. Welcome back to another interesting episode on the podcast. And I'm your host, as usual, Dr. Ron. And today I have with me in the studio Chidindu Mmadu-Okoli, who's going to be sharing her journey about how she moved from being a medical laboratory scientist into, healthcare communications in general. Thank you so much, Chidindu, for spending some of your time to join us in the studio.
Thank you very much, Doctor, for having me. Yeah, good to be here.
Thank you so much. So let's get into the conversation. So you started
Great.
off as a medical laboratory scientist. So what
Yeah.
inspired your transition into health communication?
I would say before now, I typically used to answer this question when I'm writing statement of purpose or statements. I'm serious because I just feel like people don't like it's not a conversation for people to start exploring. So
Mhm.
I just like to put it out so that when somebody looks at my CV, they don't start wondering what's going on here, right? But it's interesting that this question is coming at this time, and um, I would just mentally lift that part of my statement of purpose where I typically would write
Yeah.
that, to start answering that now. So there are two important scenarios that actually happened. Way back in 2014 when I was interning in a military hospital. One was a case of it was a non-communicable disease, obesity. This woman had come into the lab for sample collection,
Yeah.
and it took her a long time to be able to get to the reception to sit down. And by the time I realized what was happening, because I'm actually very good at documentation, by the time I realized what was happening while I was documenting, everybody had tried to take samples and they had left her there. So I got to her, tried to take her sample. It took quite a while. We were finally able to get that sample. And by the time the tests were run, the machine started flagging it as abnormal because we had a
Okay.
particular machine. I can't remember the name now. I think it was Electra. Started flagging it as abnormal. We got that result and tried to, sort of like treat it as an emergency situation. Got to the doctor. Everything was normal until evening when I was carrying my bag to leave. I saw them wheeling the woman to the mortuary.
Wow.
So she had died. And like a week later, when we had this bi-weekly mortality and morbidity reviews, they started talking about this particular patient. And it didn't feel like it was one of those numbers to me. It was somebody that I had encountered.
Yeah.
I kind of felt that what if this person knew what they needed to do, to be able to keep themselves alive, to
Uh-huh.
avoid certain things so that they could, manage obesity, of course, with the support of their doctors, if they had come in time, because more than half the time, cases come to the hospital when they have tried every other thing that's outside of normal medicine would
Last
actually
minute.
recommend.
Yeah.
And they come in, it's like they want the doctor to do Jesus feeding 5,000 people. And it doesn't really happen like that. Also, in that same hospital setting, Ebola had entered into Nigeria, and I saw a lot of people, even in churches, people coming to hospital, people I knew in church and all of that, talking about how to drink salt and water and all of that. But I just thought that I could do my own bit from that particular place. So all of these things were just seeds that I was planting here and there until I would say starting from 2016, 2018, I started getting active on Facebook. I'm no longer on Facebook anyways. And I used to write a lot of content, a lot of stories that had the moral arc was basically around health. Oh, you need to know this about smoking. You need to know this about this, that, that. They were just stories that had a call to action that were related to health until 2019 when somehow I got scouted to apply for a fellowship called the Prevent Epidemics Niger Fellowship by Nigeria Health Watch. And I was four people that got selected in the first batch of fellows. And that was how I would say, career in health communication actually took a leap, because from there, I got my first full-time role as a communications associate in a lifestyle health company where they dealt with people having chronic diseases as well as people with regular lifestyle needs. And then from there to leading communications in an organization that worked around infectious diseases, basically. So I would say that that's how my career has taken shape, or the transition has happened. I think at the heart of it is that passion to want people to get to do better by knowing better. Because I feel like from the story of the woman who had the obesity case to experiences around Ebola, one thing is there's one central theme around all of that. If people knew better, they would do better. And the only way for people to know better is when we meet them with narratives that allow them to understand what you're trying to say. Basically meeting them where they are with those narratives so that it's easier for them to take action regarding their health.
That's quite interesting. While you were speaking, a couple of things just popped in my head. So
Yeah.
it looks like a little bit of, well, or what a doctor is doing now, healthcare advocacy,
Uh-huh.
healthcare communications, trying to craft messages in a way that people can relate and take action, for their life. And basically, you have to take care of yourself. You don't wait for last minute for stuff to happen before you show up in the hospital.
Sure.
Just curious, do you still practice as a laboratory scientist or you've left that field entirely?
Okay. So the answer is no, I'm not on the bench at the moment.
So
Yeah.
you've left that part totally and this is your new front now.
Yeah, I would say I don't want to say totally because that's like my first love, but I'm not
Yeah.
the medical laboratory scientist. But then the
Uh-huh.
interest is that where I'm transitioning to, I can't speak into detail now, like elements of laboratory practice embedded into it. It's more like communication knowledge management, but there are elements of laboratory practice embedded into it. So all of those things that I had done in the past, I have to start using all of that residual knowledge to come up with narratives in the current role that I'm transitioning into.
So speaking of that now, so how has your science background or your work as a laboratory scientist helped to sort of shape your approach towards creating messages or health communications in general?
Okay, so I would say one thing that stands out that I typically think that or makes me feel like no knowledge is a waste and all the likes is the documentation part of laboratory practice. Where I had started my career, and I think it's very important because where we start is gives us all of that foundation. They were very detailed to the teeth. If anybody has worked in a military setting, military hospital setting, at least during my time, we were documenting things to the teeth. So I could practically follow the course of a patient coming into the laboratory until that result goes out. Even if another person comes and takes up the document or assesses the records, they can see every single thing that they needed to see. So for me, I would say documentation was a very strong aspect of the laboratory work that,
Uh-huh.
in fact, helped see why storytelling through writing was like an area of strength. I was doing things around the laboratory quality management systems, one of which was documents and records, coming up with standard operating procedures, a lot of writing, of course, alongside the normal laboratory work. I would also say the ability to do certain rotations where you get to meet face to face with the people whose samples you are collecting. And then realizing that beyond just sample bottles, they're actually humans who have these body fluids. When you interact with them or when you look at their forms, even if you're not interacting with them, you realize that, oh, they have, certain kinds of histories that sometimes are things that are, or health conditions that are avoidable, which still boils down to doing better if they know better. So I think documentation for me is the one of having conversations with people, trying to understand where they're coming from, as well as I would say critical thinking, because a lot of things around science, even in communication now, or science in general, involve critical thinking. You want to have that ability to connect certain dots, whether it's from the angle of length or breadth, when it comes to both practice and when it comes to communicating that practice. And I think all of this still boils down to another thing that I would like to mention. I normally tell colleagues who are like medical laboratory scientists also that as much as we have a couple of us who are on the bench who do the
Uh-huh.
work, somebody has to be able to communicate the things, the findings, the things that we see, the work that we do, even with other professionals in the healthcare industry. to people so that they can understand, beyond the, hey, we found, chlamydia, we found this and all of that. What is like the implication of all of that? So I think those things helped me transfer, the things I have mentioned, the critical thinking, the
Yeah.
documentation with people to the work that I do in comms.
Well, thanks for that. So I think you sort of highlighted some of the transferable skills that you were able to, take from the bench into this other aspect of medicine now, which you're in. So I know every transition story is not without its challenges, right? Because people think all the time it's easy to just make that pivot or make that switch quickly. But speaking from my own, because they call me ex-clinician now, because I'm in the project management space now. And I tell people that that transition wasn't easy. So looking at your own journey, what would you say were the biggest challenges you faced and how did you sort of navigate those challenges?
I would say that for some time I felt like a fraud because it's if I really think about how the first particular break kind of came with the Prevent Epidemics Nigeria fellowship. I think it was in a marketing communication role, and then I had to leave because I felt like, you know what, I can't do marketing and communications after having a first degree in med lab science. Let me just go and do masters in med lab science and teach so that the degree does not go to waste. After all, I mean, it's not like I didn't like the, med lab science and all of that. And I still found myself doing freelance writing. And then they ask you, oh, what are you into? I'm like, please, what am I into? I'm trying not to die this path. I'm trying not to. So it's
Yeah,
sometimes a struggle. And when you get to certain events and they're like, oh, introduce yourself. What do I want to see? Med lab
use
science
yourself as.
on the bench. Or would I just want to say storyteller? What type of storyteller? It's vague, right? And another challenge is realizing that even that thing that you want to move into, whether it's slowly or it happens fast, although nobody is an overnight success, anyways, is what you want to get into. There are people who already have that, people who have mass comm degrees, who already have like experience doing all of that communication. I remember a particular time that I had a post up on Facebook and somebody reached out to me to say, what do I know about storytelling? What do I know? I was trying to explain, even added things around biology just to back up, that science or neuroscience of storytelling and all of that. And by the time the person read it, they wrote one reply. I'm no longer on Facebook, so I can't remember what it was, but
Yeah.
I felt bad because when I checked this person out, they had like, I think they had a degree in English and had a master's in comms. And I was like, oh, okay, maybe they are trying to check out if I am actually, I would say genuine. But I mean, that was part of the challenge because I just felt like there are people who are actually doing this thing that I want to quickly get into. So what is it that, are you here or are you there? Sometimes you're not here, sometimes you're not there, sometimes you want to be here and there. So it's
Uh-huh.
just that particular challenge that I faced. And I would say also that self-learning and curiosity have kind of like gotten me this far. But then again, the challenge with self-learning is, how do you know that you have learned enough? How do you know that you learned enough not to feel like a fraud? So yeah, learning has to be continuous. But sometimes one has to just pause, like you had mentioned earlier, to say, oh, you're taking a break from studies, to do more work, because of course that would inform whatever you want to do in future and the like. So I think one of the challenge for me was how much learning, because I was taking courses here and there, and I was like, you know what? I think I need to stop at this point and start practicing all of the things that I have learned, basically.
Thanks for that. I mean, it makes a lot of sense because I think where a lot of people miss it is where they sort of forget about challenges, especially when people are transitioning or moving into other areas they're not aware about. So, yeah, it's good. I think you highlighted some of those ones you face so that people who are watching don't think it's that you just move
So what?
quietly and exactly like it's a walk in the park, really. So, thanks
Yeah.
for that. So let's look at storytelling a bit more. So why do you think storytelling is very crucial in public health messaging? So earlier on, you talked about the neuroscience of storytelling and probably why it's important. Do you like shed more light on that?
So people don't think in data. They're saying, oh, 70% of diseases are of zoonotic origin. You are wasting your time. If you're not telling them things like, out of every 10 persons, 7 out of 10 have diseases that come from maybe their interactions with animals, right? So with public health messaging, storytelling is important because people are not thinking they are not thinking academic papers or scientific literature. They are thinking in day-to-day language, sometimes in street language. If you read case studies of certain kinds of campaigns that have done well, especially in Nigeria, not like it's like properly documented, but I'm talking about
Yeah.
things that you find that for some campaigns, like things around sexual health and reproductive health, part of what enabled the people who led that intervention to actually do it is because they learned street language. The things that you want to teach people about, they have street language. So storytelling more like brings that relatability, comes down to the human, how humans typically understand things, as against trying to speak in some kind of medical jargon and all of that, which still boils down to the thing that he had mentioned about, oh, a cocoa doctor does this, and we like the way, I personally like the way that he does it, because it's like coming down to people's level to
Yeah.
create strategies that meets them where they are. And the only way to do that is actually through stories. If you're not coming to people with, the universe is made up of stories. I know that there are atoms anyways, but stories are the most important thing. If you're not coming from that angle, if you're coming
Mm-hmm.
from that makes that person feel more confused by actually approaching you, it's going to be a waste of time. That's why you hear of people going to do maybe certain kinds of interventions in certain kinds of places. I remember one story that I learned about in branding in masterclass for non-profits, where they had gone to this particular community, shared mosquito nets. I don't know how the intervention was implemented, but they came back there and found that the community members were using the mosquito nets for fish farming,
Wow.
and we're happy to have malaria while also. So these things are, you have to come from the angle of relatability, and being relatable means telling stories that, like I said, meet people where they are. And you cannot tell stories without also understanding, who these people are, what their day-to-day activities. So when you come down to storytelling, it means that, see, I know that I have an intervention for you, but
Yeah.
you also have to play a role. So I need to understand your own perspective to be able to say, "Oh, take everything, take what I have," while also trying to understand where you're coming from. And I think that that's how powerful stories are.
So now, one question that now comes to mind is, we're
Okay.
looking at, you know, translating scientific stuff or technical stuff into
Mhm.
very simple, relatable stuff. So, how do you navigate that difficulty of translating and also maintaining scientific accuracy whilst telling your story? Is that a challenge?
It could be a challenge, but I think for me, in working in comms, most of the communications I've done does not happen in silo. Like, it doesn't happen outside of the key technical people, subject matter experts, or
Okay.
even organization. There are programs people or program managers.
Yeah.
So when these things, when they come up with, some of these their findings, and you want to translate them into key messages, you want to know what it is that shouldn't change. Of course, in a line of text, or in a line of what they call it, I would say campaign messaging that you want to share, or a line of social media content, depending on what format that messaging is taking. You want to know what it is about the science or the facts that should not be tried to be watered down, kind of like, and you want to know what you need to break down, right? While that is sometimes a challenge, I feel like maybe that's where having that, background that I have kind of like comes in, because I know that how would typically WHO say it, how would the NCDC say it, if it's an area of intervention that also aligns with them. There are also like communications, public health communications tools on websites like the US CDC and the likes, that sort of like provide guidance to alternative names to certain things. But of course, certain names don't change. You
Yeah.
just want to find a way that you break down that thing, the meaning, in a way that it's not watered down. So instead of going to tell people things around mortality or morbidity, I probably want to, move down to something like, oh, the rate at which people die, or death rate, and maybe the rate at which people have that disease, as against using, the book. It
Mm-hmm.
doesn't that the meaning, goes off, but it's just done in a way that people are quick to understand it. And it could be a challenge, actually. It's not typically a challenge for me because most times I have to deal with subject matter experts or the programs people, concerned with them.
Right. So earlier on, you mentioned a bit about where you sort of get into the community. You need to find out who they are, probably what are their challenges or whatever before sort of implementing whatever. So what role do you think culture plays in shaping effective health outcomes?
Hmm. Culture is the way of life of a people as we typically define it. So before you go to tell somebody that you better do this thing or do this thing this way, you want to again understand where they are coming from because that way of life is the thing that shapes how they see certain things, right? And I mean, from the Nigerian perspective, for instance, if I want to go to a community in northern Nigeria, I remember a program that my colleagues had implemented in some specific border communities.
Mhm.
And going to those places, they realized that if you wanted to talk to people, you don't gather people in a hall like man, woman, put them together, children, or rather youth, not children, and then start telling them the same thing. You have to meet the men separately. You have to meet the women separately because they are comfortable relating with you or accepting the message that you're bringing if you separate them because
Yeah.
every culture has the way you interact with them. If it's typically somewhere in maybe southern Nigeria, you can bring men and women together, put them in the hall, and just do that like that mass education or information that you want to give to them. So
Yeah.
that's one. Another thing again with culture is certain people see certain things in certain ways. I mean, it's something that I have said. So if you are going to, I remember one case study like that. It's not so clear in my head, but it's an advert that was done, and it was done in such a way that the people did not consider women from northern Nigeria, their peculiarities, and also some of them kind of like marry way early than the others from southern Nigeria. So it felt like those from northern Nigeria were kind of like marginalized, right? So these are things that one needs to pay attention to. Also thinking of how these people, what their day-to-day activities are like. If there are people who typically maybe believe that certain things cannot come to them because they worship a certain god or they do a particular, traditional practice, you want to use the faces of influencers in those communities or in those settings who already have an understanding of how these things work and also have an understanding of public health or some level of health literacy to pass on that message. So if you think of things that happened during COVID, where some religious people were still having gatherings because they believed that, Psalm 91 and the likes, but then in some religious settings, there was like, I would say, secular going around in some certain settings saying, this is what the government has said. We
Yeah.
are answerable to the government of the land based on, of course, science and all of that, and not just that they are following the government foolishly. Please ensure that there are no handshakes, maybe kiss of peace in church. Don't do
Mhm.
this, that. All of those things are things that kind of shape how messaging or public health campaigns or interventions are actually received. So that means when anybody is designing communication programs, they want to keep that in mind. And where places are like hard to penetrate, is it possible to use these cultural influencers who are respected in these societies to have them actually transmit that message to the people who find them relatable, as against just penetrating the community and then just speaking directly, because that would be like pouring water on rock.
Yeah. So the importance of those influencers cannot be overemphasized, right?
True.
That's one
Yeah.
of the key messages I took from there. Now we're in the social media age, right? Digital age. Everybody's on social media, WhatsApp, different platforms, and all of that. From your own
Yeah.
perspective, how do you say social media has changed the way we deliver public health messages?
I would typically like to imagine what happened in the era of smallpox. I don't know. Did they bring them to a campfire, a village square to say, oh, there's this disease? Of course, while at the same time trying to avoid the spread of the disease while it was gathering, did they use town criers and all? But over time, we went towards television broadcast, which is like traditional media. With social media, which is new media, it's not one to many. Like I come to the radio, oh, there's this, wash hand, and everybody goes. With social media, there is, if you look at how communication goes, there's the person sending to the receiver and the receiver giving a feedback to the sender. It's happening in real time and at high speed with social media. So that means there's that tendency for people to just stick on what comes to them constantly and over time based on who is the first to put out information continuously, right? And that kind of like affects how social public health messaging is seen or shared or accepted. There are people who use faceless accounts to push misinformation. Problem. As against when you think of all the processes, all the journalistic rigor that goes into publishing news on television, on any of the news platforms. That's a challenge. But now with the way social media works, and even the fact that algorithms have changed. Before when we used to be on Facebook or Twitter, we would have, when you come to your feed, you see like this person posted 15 minutes ago, then the next post above is somebody that posted 45 minutes ago. Algorithms have changed to interest-based algorithms. So if I kind of interact over time with a certain kind of analogy or misinformation, I would even say homophily, which is like a bubble where people just live in. You don't want anybody to tell you any other thing otherwise.
Yeah.
That's a challenge because social media algorithms are now wired to be interest-based. So that means you have information going out fast. You have the potential for virality. At the same time, you don't even know some of the sources where they are coming from. And lastly is anybody can curate their own world based on whatever it is that they want to believe. So these are things that kind of like shape or maybe even hamper how public health messaging is received. And somehow I think that when we look back to things that happened during COVID, it was a lot of work that the NCA had done trying to put out information in real time, communicating the science that we knew and the science that we didn't know. Because once there's a gap, just assume that that gap, no matter how small, is how misinformation will just take its place and then start spreading. So I think that that's how social media has basically changed how we communicate health now.
I mean, speaking of NCDC, I think I really love during that COVID-19. I think they were on the top of their game, really. I must give them their flowers, really.
I'm glad for them too.
Yeah. Then you mentioned misinformation, which is a big problem. I think a lot of people are struggling with now with social media because, like you rightly said, we don't even know the source of the information. People really don't have that time to start sort of checking where is this coming from? Is it verified? Is it authentic? Before you know it, is in various WhatsApp groups, everybody sharing left, right, and center without actually. I remember during was it Ebola time? They said people were drinking salt during Ebola, and people sort of passed on from there. So, what would you say from a health comms perspective now?
Okay.
Best approach to tackling misinformation online.
Okay, so one of the things I recommend is even checking what kind of misinformation that is. There is misinformation as in we just don't know. We're sharing in case because with WhatsApp and how even older family members or religious groups were sharing, they say we should wash hands, they say we should drink salt water, this, that. It's just in case. It's not intentional.
Yeah.
Then there's also disinformation where people actually, there's even the one I heard that they set up labs where disinformation is manufactured and then, especially around COVID, and then put on the media. And those who have agenda, everybody just starts amplifying. So it's to find out if it's something that you need to engage with misinformation, even with disinformation. You need to engage even real quick, right? Sometimes it has to be primarily on the platform where that source of misinformation is happening. So if you hear from colleagues who do risk comms, especially for NCDC and the likes, they used to have this tracker where they were constantly tracking information using certain keywords over over time. It's a lot of hard work. And once you pick one thing, whether it's a negative sentiment or something that is a misinformation around maybe vaccine or the virus itself or whatever disease it was, everybody needed to start getting to work to more like create counter information against that particular misinformation. So that's basically what is called debunking misinformation. But sometimes the best approach is actually to pre-debunk misinformation, which is also what you see when certain times or seasonally, maybe platforms like NCDC or Breakthrough Action, and they like to say something like yellow fever, blah blah blah. This is what you should do. Keep your kitchen safe, your food safe, and the likes. You would find that sometimes it's just before the season of Lassa or yellow fever or whatever it is. They share all of that information because they want to not have any space for misinformation to come out from anywhere. So you find that it looks like, oh, there's a massive campaign when there's nothing to celebrate per se. It's not like a public health day. They are using radio, they're using television, they're using their social platforms to put out information about something before even that misinformation starts to come out. So there's the pre-bunking, which happens before any kinds of misinformation comes out. There's the debunking, which actually happens, while the misinformation has come out. But then even after you debunk, you have to hang around because even misinformation has a cycle. It's a lot of work. You have to keep monitoring like a hawk. You have to keep watching for sentiments. How are people taking the messaging? Do you need to create an additional messaging to address all of that? I would also say another thing again, which is something that we've mentioned, is also using trusted faces to address that, right? There's something I learned lately. I think it was from a theory called celebrity media theory, where they had used a particular celebrity to talk about cancer and a couple of other diseases. It's not here, it's abroad. The person is actually well known and has a family history of cancer. He made that messaging around that particular type of cancer. So people are not thinking, oh, I have to wait until the first sign appears. No, you have to keep going to the hospital for your yearly checks, just so that if there's anything, they are quick to catch it before the thing actually becomes very, very bad, right? So that's another thing that works with misinformation. I would say that constantly pre-bunking or debunking is not even enough. There's a need for people to just have, I would say, health literacy, media literacy. I don't know how that will happen. Sometimes I think of a particular country in West Africa. I don't know if it's, not West Africa, in Africa. I don't know if it is Uganda or Kenya, where when I was doing a paper on WhatsApp misinformation, actually, media literacy to people from primary, secondary schools, right? So if people understand that when people present half-truths and people present certain things that it looks like it's fact, it's logical, but then it's not even complete. There's too many things that, compound to give rise to misinformation. As much as the communicators will do their part, I think maybe over time, what is continuous and will continue to be like a journey, but not a destination, is that an intentional act to teach literacy, health literacy, media literacy, so that people can understand how to verify information before they share.
Yeah. So those, I hope you guys are watching. If you're in that space, have work to do in terms of, teaching media literacy and all of that. So let's look at a little bit about your day to day, because I know I usually get this question. So as a health comms person, what's your typical day? What does it look like? What do you actually do by the time you step into the office?
Okay, so I will use a recent example. Now, comms is wide, and then there's health comms. Even inside health comms, there's healthcare comms, which is like patient provider. The part that I do is around public health communication. Okay. So for me, it's typically at the end of the week or towards the end of the week before the next week. I'm looking out for program activities that are related to where I work that are worth communicating. So if it is beneficiaries, quote unquote, or people who have benefited from the intervention, sharing how they have amplified that work, that's a story to be told. If it is basically just informing people about certain kinds of diseases that are common, especially diseases of national interest, breaking certain things down. So if this week they have to learn about, how that disease is contracted from their day-to-day activities, what they need to do, Because a lot of the diseases or public health diseases that we have are things that are, especially for communicable diseases, are things that diseases of health are around equity, poverty, people's income, how they live. Some of those things are lifestyle, even for non-communicable, like, certain things like obesity and the likes. Of course, there are times when it could be genetic, right? So these are the things that sort of like frame the kinds of messaging that will be created. There's also considering trends, what is currently happening in the world,
Yeah.
with the way, I would say funding has been frozen. There are things around, concerns around people living with HIV and AIDS. What do they need to know? Pieces of information that they can take succor in while the world looks at resolving whatever is currently going on, and then plan that in a calendar. I'm looking at social media, for instance. Plan that in a calendar. Work on whatever content that whether it's a video, a graphic, and then alongside their captions, it has to pass through, whatever it is, has to pass through 2 levels of edits. And it's important, especially if you're communicating through an organization and not like freelance. So two
Okay.
levels of edit basically is that you have to take a look at what you have written alongside with someone from programs or who has a technical expertise or a subject matter expert to say communication is beautiful, but based on the numbers from NCDC today, some things have changed. You need to adjust the data, right? And when all of that is done, you pass it through management edit, because anybody in management are typically people who have very very extensive years of maybe public health programming, leadership, and the likes. They understand current trends. They also understand how the organization wants to be positioned, even through that messaging. Some people want to be positioned as thought leaders in specific public health areas. So we want to they check for all of that alignment before saying, oh, this gets your approval next week. Schedule for maybe Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, whatever it is. But a lot of work in comms is planning for socials, planning for other channels. If you have sensitive or rather key information that requires that you get on media platforms, you want to also have that level of media relations experience where you're engaging with journalists and also providing information that they need, or allowing yourself, be that subject matter expert that shares key information, maybe based on your findings from the work, so that other people, especially the public, can benefit. So it's a lot of planning and creation and distribution of messaging, but not in silos, like I had mentioned. It has to happen with, even if you're working as a freelance person, you have to check what is currently happening, even with the landscape, public health landscape, to come up with certain kinds of messaging and campaign narratives around health.
That sounds very, let's say, complicated or complex. Sounds very busy. So
Some
just
things are
curious
better
now,
than but yeah.
right? So are there any, if I was a newbie now thinking of this, right? Are there any specific tools, specific applications that you sort of need to get conversant with before starting out in this space?
I don't know that there are specific tools per se. There are tools that can help. For
Okay.
me, I would say my only tool was curiosity. I wanted to know everything. I wanted to read, to get information. So if you're going to do health communication, whether it's within an organization or in a healthcare setting, you want to look at what are the foundational materials that are there already, and then what are also the trends. In the role that I just transitioned from, before I joined, I already read their annual reports by the time I showed up at the interview. So I knew the kinds of things that they were doing. And then when you get into that role, because you can't know the end from the beginning, you want to sit with programs constantly. You want to attend their meetings. You want to hear what they're saying, because it is from those activities that the stories will come. It's not going to happen in silos. You want
Mm-hmm.
to know what the challenges are, where they've been, where they're currently heading to. That will help you know the kinds of narratives that you want to share, especially regards to specific interventions. And if it's not intervention specific or around maybe public health activities, you want to look at what are the things already existing. Say you're planning around campaign days. February 14th just came and went, which is Valentine's Day.
Wow. Yeah.
But I think February 13th is International Condoms Day. So let's say you're doing work around sexual and reproductive health. You want to know the kinds of what is currently on ground, especially globally and of course locally, and then plan around that. Understand how content calendars work, especially with regards to activities that are tied to the program area of the organization that you work in. If you work in a lifestyle organization, you want to know things around obesity day, diabetes day, and the likes, and then see how you create narratives, whether it's a 1 month campaign you want to plan out around that to position yourself or position the organization as thought leaders in that particular disease area, and to also educate people. You want to start planning around it. But I think communication does not happen in silos. And I say this because I have over the years been drafting communication strategies and all. And I'll say the best ones that I have done are ones that are tied to understanding where the organization is headed. Because without that, the communication would just be that you're just saying what's on your mind, and then the organization has another thing that they have in their
Yeah.
mind. And before you know it, sackling.
We
So
don't want to get sacked.
when it comes to tools, there's a tool that has actually been helpful, although I don't use it often. Maybe it's because I have a medical background, but for people who have to do health communication that do not have, health background, or do not have health background, the CDC has a public health communication. I can't remember the name now, but it's the function of that tool is to help break down jargon. So if you're constantly encountering public health words like pathogenicity, morbidity, mortality, and the likes, it
Yeah.
helps break that down, right? There's also that thing around if you're using AI ethically and you encounter some of these jargons, you can actually ask whatever AI tools to help you break it down. But at the
Yeah.
same time, sure that you're cross-checking that with subject matter experts in your team so that you're not watering down what should not be.
Content.
There are a lot of tools on health literacy, also on the US CDC website. I can't remember what it's called. There is a platform called Public Health Communication Collaborative, where they have sessions educating people on key public health issues and how to communicate them. I think there's even one currently around, this funding freeze and all what people need to know and do and the like. So Public Health Communication Collaborative is another platform or a community for public health communicators or communicators who do work in public health to ask questions, learn. They are constantly teaching. So they also have I would say that e-learning platform that they just recently launched. So it could
Yeah.
actually help anyone who is looking for information on how to, get their hands on as they transition. Yeah. Hope this helps.
That's really helpful. I mean, you share tons of resources that people can sort of go to in terms of trying to figure their way around this. So let me just switch this back. So if I approached you now, I'm a healthcare professional and I'm looking to transition into what you're doing now, what would you tell me? What are the step-by-step approaches you say, do this or don't do this?
Okay, so I think I will start with how I was approached also to say, oh, I'm looking for a comms person to be in my team. Part of the things that helped me get my first full-time role was there were practically just footprints of things that showed that I was passionate about communicating health. Whether it was on Facebook, you would see the narratives. It was on Medium. It was on stories that I had published. In fact, there was the interview happened at a conference. The mini interview happened. I didn't even know it was an interview, in fact. They just asked me, so what are the things that you said you have been doing with Canva? And I had like an entire folder of designs that I had randomly done just to
Wow.
communicate certain things around, whether it was hand washing with stories, whether it was things that had to do with communicable or non-communicable diseases, but then with some form of relatable stories around them. And the person just told me, this is good. Can you share with me? And I did. And next thing, they sent me a message on WhatsApp asking for an interview. That interview happened on WhatsApp. It was like a call with two people at the other end and myself. And that was how I got hired. So there has to be evidence that you're passionate about what you're doing. So whether it's a passion project you want to do, even if it's, simple podcasts like this, have conversations with people around that issue, put
Yeah.
that in a portfolio. It has to be in a portfolio. And sometimes don't wait until the opportunity comes. If you find as you scroll online or check online that there are people who would need that, please message them to say, I think I can help you with this and that and that. This is what my portfolio looks like. I'm happy to talk when you're free. Sometimes they might not be hiring immediately, but whenever they know that somebody has actually reached out and they keep that person in mind.
Yeah.
So yeah, just have that. And while you have that portfolio, ensure that you're also present at certain industry events, because I'm not going to lie, the person that interviewed me would not have interviewed me if we didn't see in one particular.
In that event, yeah.
So where you have activities that are related to your area of interest, especially in that industry, please just go out and go and meet people, even if it's to greet and go. Yeah.
That's interesting. So earlier you mentioned you were part of that program organized by Nigerian Health Watch, the
Sorry, let me
Epidemics Fellow stuff, right?
Yeah.
So how impactful would you say that was on your career, really? Because these days I know a lot of people talk about, doing internships, doing boot camps and stuff, just sort of build you up for your role or something. So would you say that was really, really helpful?
I think that this question is even bringing another idea, because part of the last question that I didn't answer was that the most important thing in situations like this is getting your foot in the door. So the answer is yes, very well, yes. And I would say that that was also another defining moment for me, because we were brought together. I was somewhere in my house. Someone called me to say, "Oh, I've been seeing all the things you've been writing. One thing, one thing, one thing. There's an opportunity that I think you should apply to." They mentioned me in the Facebook comment section of the opportunity, and I just applied and I looked away. Then I think the next year, somebody called me to say, "Oh, they got my application. They have also seen all the things I've been writing about, and they want me to attend this masterclass in health journalism." So it was just a random day, and that call came in from that application, and I went. And the masterclass held, I don't know if Nigeria Health Watch still does that masterclass, but I think they need to actually continue to do it, because there's a lot of insights from there that actually helped me see certain things the way I see them now. Right.
Okay.
So the masterclass held, I think, we're a couple of people, about 30 or so. And they said, oh, they're opening up a fellowship and only 4 people will get into the fellowship and we should submit our stories. I did. And I got into that fellowship. I learned another way of, there were certain things that you just read, but going ahead to do them as per field, going to interview people, going to see the field, say, oh, I'm looking for somebody who has suffered from Lassa fever, because I had to interview a doctor who had actually suffered from Lassa fever. I had to speak with colleagues who were working in infectious disease clinics and infectious disease laboratories and all of that. So it vivified whatever storytelling was for me. It was like me getting my foot in the door. It was a very valuable experience. And to cap it all, the final period of the fellowship, when the funders had come into the country and were supposed to give a press briefing. At that press briefing, one of the persons who spoke was the former US CDC director who now leads Resolve to Save Lives. His name is Dr. Tom Freden. And he commended my story. Like I knew that he read it because he mentioned things in that story that had me like, okay. And then he was like, I like that you used human stories to vivify more like the numbers. When you say, oh, 10,000 people died of Lassa fever or 20 people died of Lassa fever, you actually put a face to that, say that doctors can actually die while actually caring for people. Although in this case, this person did not die, but they still live with the complications of Lassa fever. More like giving a case as to why funding infectious diseases detection in laboratories, as well as even in hospitals, is actually important. So that particular experience where he said, oh, I like that your story gave life to numbers when it comes to infectious disease, I just knew, like, you know what, I'm going to do this health communication thing. If like I used to doubt myself before, and they'll say, oh, what are you? I'm like, am I a lab scientist, a med lab scientist? Am I this? Now I'll just say, you know what? I'm a health communicator. If you don't like it, come and drag my shirt. Let's see. So yeah, it was a good experience. And it was also in the course of communicating that work that I landed my first full-time role as a communicator, especially in the public health sector. So yeah, it was good. It was good. It was really good.
Thanks for that clarity, that
Yeah.
the internship or whatever you call it,
Fellowship.
yeah, fellowship was
Yeah.
actually very impactful. So because on this side of things too, I tell people look for internships, look for boot
Mhm.
camps because they sort of, get you a foot in the door, if we can use, that word. Then one of my fun questions, do you miss the bench?
Do I?
Do you miss the bench? Do you miss taking samples?
As a human being, I think I miss laboratory work, but I don't know that I miss the taking samples.
Mhm.
Yeah, because I don't like people also taking my samples. Although when I used to do all of that, because phlebotomy is just one part of
Yeah, absolutely.
pre testing work and all. I was actually very can say, okay, put the needle like this and blood. But I think the things that I miss around medical laboratory practice is the documentation part of it, because every single process involved the places I had worked involved serious quality management systems. Like you need to apply laboratory quality management systems. And I liked that somebody can come into the lab at any time and not doubt whatever results we're giving out, basically.
Yeah,
So the documentation part is what I miss.
is what
And
you mean.
maybe hematology, especially the blood film part. Making it, yeah, because when it comes to looking at blood picture, there's nothing you won't see. Sometimes um the way some of the cells, whether it's erythrocytes or the leukocytes present themselves, they're like, okay, maybe there's an infection. Oh,
Hmm.
why is the red cell jagged? Is this person a smoker? Whatever. Make whatever picture comes to your head. But of course, you know that you can't make that decision
Yeah.
outside of what the medical doctor says. But just that thing of having to do the processes in hematology specifically, because the other places are hard. Yeah.
Okay. So a little bit about AI and public health messaging. Where do you think
Okay.
that's going? It all this talk about AI every day.
Um, AI is important for any kind of work, including public health. Where I personally have issues is with the ethical parts of it. When there's now ethical dilemma, like why are you putting so if you want to come up with certain kinds of maybe public health messaging that require you to release intellectual property into the AI tool. Why? Because the AI that keeps is basically a language learning model. It's what we feed into it that it will now take and maybe feed to others the same way it has collected from others and fed to us. So
Mm-hmm.
with AI in public health, there are ethical things around it, like maybe when you want to design certain kinds of public health messaging and you need maybe outline or structure or whatever. I think that helps. There's also AI in automating certain functions. So you find there are public health or rather health tech platforms. I can't remember one now. Where is it Help Mom or what? I'm trying to remember, but there are lots of maternal health tech related platforms now
Yeah.
where a pregnant mother can say, "Oh, I'm in my second month. I just encountered this challenge," and because the bots have been trained over time and quality controlled over time, they can give out that information. Except that person not specifically says, "You know what? I want to chat with a doctor or a nurse because the questions I have are now way beyond what the bots have been programmed." These are really good. These are really good innovation because it saves time both for the people who oversee that platform and for the human who actually has an emergency and might need help, right? So I think that AI helps us do better, or like a quote says, AI will not replace doctors; it will replace doctors who do not know how to use AI. So AI will not replace anybody; it will replace anybody who doesn't know how to use AI. And I
So we
would
need to
say, who
upskill.
doesn't know how to use AI ethically.
Yeah. Okay. So as we wrap up, what advice would you give to healthcare professionals who are looking to exploring a career in healthcare communication?
I would say for me, it's curiosity. That's what has gotten me this far. Please always stay curious. Don't ever think that anything is too complex. If it's complex, try to take your time to break it down. Be in the places where the people you are looking for are. right? And please, I want to put a caveat here because there's a way we see network in this country. You meet somebody for the first time. That same moment, they become your alpha and omega. You are not exactly thinking about their own, what makes them human or what their own challenges are, right? But it's a gradual thing. Put yourself out there, leverage the platforms that you have, build a portfolio around a passion project, whatever that is, so that when opportunity comes, you don't have to go and start preparing the portfolio. You should have prepared for war before the war, right? So I would just say curiosity. Please put yourself in places where you can be seen and build things that you're passionate about as part of your portfolio.
Amazing stuff, really. So I think my key takeaway is that curiosity part. And to be fair, I think for myself too, that's also what has brought me this far, being
Mhm.
very curious, being very
Yeah,
open to learning, trying to understand stuff you don't understand, being able
true.
to questions when you're confused, because I think some people just assume. Assumption causes a lot of issues. So
A lot of issues.
yeah, exactly.
Yeah,
So thank you so much. I mean, we could go
thank
on and on
you.
and on, but I think it's been a very interesting conversation. And to be fair, I've learned a lot because,
Mm.
until you understand what people do actually on a day-to-day basis, it's easy to say, is it not just this thing? Just write this copy and just send it out. Look for numbers here and there. Just send it without understanding the depth of work that actually goes on behind the scenes.
If I'm going to interject, I think even to myself, it's even becoming much more serious because
Okay.
now I'm learning things around media and communication theories. I'm learning things about media ethics, organizational communication, and all of the things that are around it. I'm like, okay, I've been doing this thing. It's not like I've been doing it badly, but the way I'm going to now have to do it going forward, it's
Changing.
now going to, it's like you have gone to the comms has gone to secondary school or university or whatever it is. It's no longer at
Yeah.
primary level. Because over time you realize like when I learned about health communication theories, I said this is, I think it was elaboration likelihood method where they had mentioned one thing about how people don't necessarily take in health information until they see who is delivering the health information. And
Uh,
then it just made sense to me. Like maybe this is why we use religious people to go and start teaching people in certain
yeah.
places about health and all. So I think now it makes even a lot more sense. It's no longer like, oh, is it not just to write? If anybody tells that to me, typically I just get irritated. But even now, I don't think anybody can tell that to me with the things that I now know
No.
about foundational theories in media and communication, basically.
Uh-huh. Okay, so where are we going to see in the next 5 years?
I want to sound like a Nigerian. We wait until God takes us there. But I know that life has to be intentional. So
Yeah.
in the next 5 years, hopefully I become a teacher teaching health comms. I think that's all I can say at the moment. Because I really
Okay.
want to become a teacher. Of
We'll
course,
keep
as well
an
as a practitioner, basically. Yeah.
keep an eye out so that we'll come and join your master classes or fellowship or whatever. But yeah, we'll keep an eye out for you. And thank you once again. It's been an
Thank you
absolute
so
pleasure
much for the time.
doing. And
Thank
for
you.
those watching, I hope you guys enjoyed the session as much as we had fun putting it together. And YouTube says, I think just about 80% of people who watch actually subscribe. So if you're not subscribed, please hit the
Please
subscribe.
subscribe. Oh.
Hit the
Yeah, we want more
subscribe.
people to learn about health comms and
Yeah,
transition.
that's
Yeah.
thank you so much.
Thank
So, like
you.
I usually say, I'll see you guys in the next episode and bye for now.